going on, everybody? It's Miguel here again in the Torture Room with another video. And today we have a really amazing client coming in today, and it is Ranya. And if you haven't heard of her, here she is. Boom. All right, now this girl is really leading the way this year. A lot of eyes are on her, so she's coming in massive, very detailed. She's coming in very proportionate, and I'm very happy I have the opportunity to work with her here in the Torture Room. So today she really wanted to work on legs, but she did tell me about just a tiny little issue that was happening in her elbow. Too long. Where were you feeling that elbow thing at? Like inside the elbow, outside, maybe right inside here where the bicep attaches.
God, I feel like it was more so outside.
More outside.
We're sore, and then when I was like just going to lift weight, like a plate.
Yeah.
And I did this motion.
And
maybe it was this side.
And you kind of felt it. We'll work around the whole thing.
Yeah.
So when Ranya came in, I obviously love to see athletes hit a few poses for me just to see what we're going to be working with. So we wanted to see the legs. Damn, that's crazy. That's very crazy. Huh?
Lines are still there.
Lines are still there. Got some thick legs, yo. All right, let's see the hamstrings.
They're the ones that we can't get to pop as much at the moment.
Yeah, it's all a process. So we'll definitely work on the hamstrings too. So, but we'll start you face up because we're going to start with the elbow, the arm, the wrist. Just get all that taken care of. A little bit into the lat just to make sure that's not aggravating the elbow as well. And I'm going to jump right into the legs. Yes. Kind of want to see what the shoulder placement was. This just gives me an idea of what I'm really going to be working with and how we can actually get this treatment detailed just for her own personal goals. She did say she wanted to work on the legs, but then she did say she did have a little bit of issue with an elbow, which was only the right elbow. And if you could tell when we were talking about it, it was during a specific movement. So we're just gonna take care of the small stuff before we get into those massive legs. So working with the elbow, I decided to use 3 different types of scraping tools. One was the metal tool, the second was the stone, and the third was the bone. So why choose all 3? Why did I break it down in that situation? Understanding her story and the symptom, the first thing I wanted to do was just open up a little bit of that elbow joint by releasing tension off the attachment points, bringing pliability to the muscle tissue. That's why I started with the metal. If you want to scream like you're in massive pain, it's good for the channel. So we'll be in a few minutes. And then I went into stone just to soften up any of the connective tissue, the fascia, bring pliability into the fascia. And then the bone I used really close to the joint. All that just to help release tension off that elbow joint so she can just control the movement whenever she's doing any kind of flexion right there. So I try to break it down as much as I could in the video of what I was really doing. So have you felt this elbow pain before? Is this kind of the first time in a while?
It's been a minute. I think I've felt it like once or twice before. It doesn't happen often.
Okay, that's good. Just trying to see if it's a reoccurring thing, you know?
Yeah.
So as this treatment unfolded, we then went straight to the legs. That was her biggest concern. She always wants to get her legs worked on. So everybody hates leg day on the gym floor, even in here. So, and what I'm looking for is just the integrity. I don't want it to start feeling gritty again or knotted up or gummy or nothing like that. We want them as pliable as possible. That's how you know you can keep pushing more blood inside that. This one, we did a little bit of manual therapy, and we did use the ASTEM Graston tool. With this one, a lot of people always ask me, how do you work on bodybuilders? She is 10 weeks out, 10 or 11 weeks out, somewhere there. So it's like, I always get asked, how do I work with them? Don't traumatize the muscle tissue. So as you can see, I'm not dropping any elbows. We're not seeing how much pressure she can handle. At this point, we're looking at, can we get the muscles to pop? Can we make them look full? And can we still keep her performing in the gym? So we did some manual therapy, only using the fingertips just to soften up and bring pliability to the fascia. And then the metal ASTEM tool was used to contour the muscle, and that's to break up any deep fascia to help with muscle separation. We started at the center of the quad, then we went to the medial quad, and then the outside. We even hit a little bit on the IT band. The IT band, I strictly only use the stone. Why the stone? It will not traumatize the muscle tissue. A lot of people always think, hey, if your IT band is tight, let's just put pressure right on it, whether it's the foam roller, the elbows, or even scraping. That is a no-go. So I don't do that here in the torture room. We use the stone, and we work right underneath just to kind of peel that IT band up to bring more movement from the joints. So from the quads, then we went to the hamstrings.
I think the hard part's over.
Yeah.
Maybe. You don't believe me, do you?
Oof.
The hamstrings, I strictly stayed with the stone. That again, stone will not traumatize the muscle tissue. So my whole focus is just to bring pliability into the fascia. When the fascia is pliable, the muscle can receive more blood flow, can actually perform better. It has better movement, so she can get full range of motion, good contraction in the muscle tissue, still keep performing in the gym. Again, we're just contouring each muscle belly in the hamstrings and then flushing everything out. If you notice, I even did it on the quads. We did some effleurage, open palms, and just flushing everything towards the heart.
Like a more sensitive area.
No, stone won't traumatize muscle tissue.
Okay.
So the muscle tissue won't get inflamed. The stone is very superficial and will just kind of bring pliability to the fascia. And that's what we want. Once that fascia gets very nice and pliable, you can push more blood in here, and the muscle has more room to pop when you actually contract it, like when you post. Just flushing everything that was probably stagnant, just to get things moving, get blood flow moving. So the muscle tissue, again, feels like it's actually getting recovery work, not trauma. There was a small portion where I was working on the calves. No tools, just manual therapy. This was petrissage technique right here. And all I'm doing here is just relaxing the calves because the hamstrings do bypass that gastrocnemius muscle. So that meaty portion of the calves, we just want to relax that whole joint. So the calves do play some kind of a role when there's knee flexion and hamstring contraction. So we just want to relax those so she doesn't feel like there's any restriction from joint to joint, activating muscle to muscle.
See how much deeper we can get in there? And you know, you're still going to get more detail, pushing more in there because you're going to isolate that muscle when you're training a lot. And we just want it to pop and make it look as clean as possible. So the more we can just release the fascia, all that connective tissue around it, now the skin, the tighter and tighter you get, can just contour all the muscle tissue. Let's stand up and let's see you pose a little bit.
Then we had our pose after the session, and we can actually see some of the muscles start to pop, even some of the feathering start to come up. It's starting to show. She's still 2 months, a little over 2 months out, so we have a lot of time to work with her, a lot more detail we can just bring out of the body. So
wild difference from 10 weeks to like 2 weeks. And it's already, you don't have a lot of skin pull either, so the leaner you start getting just the excess water and everything else, it's just going to be insane. Like the polished look at the end, because a lot of that magic will just come through that 10 days out, 7 days out.
I think this was a very successful session and just one of many, and we'll see how this ends up unfolding as she gets closer and closer to the USA, so which is held here in Vegas. So I'm very happy I get to work with her. So if you like this video, hit subscribe, leave a comment. I'll get back to as many comments as possible, and I'm looking forward to the next video.